I've been working on a platform it's under Spartan Legacy Group, and it's the Ironclad HC platform. We basically do an intake of 8 to 10 questions, and we gather that program from you, and then it puts it into different stages of feasibility studies, the size of the ORs, how much you need to invest. It gives you a hard cost, a soft cost. It breaks the whole entire project down within 10 minutes instead of going through the process, hiring multiple people to do the same thing that this platform could do. And I could get it done within 10 minutes. And it's all across the United States. And what's unique about our platform is every state has different regulatory guidelines, and this state, the platform per state breaks out the regulatory guidelines and what it would cost and what guidelines you need to follow.
That's really great, because there always has been a knowledge gap between the developer and the client, with the surgical centers, and we when we spoke the other day, we were talking about. Welcome to the Yacht Captain Investor Podcast. I'm your host, Scott Kidd, where every week we dive deep into conversations with real estate pros, business owners, and maritime professionals about their mindset and journey to success. Please help support us on our journey and our channel by liking, subscribing, and commenting below so we can help you in your journey to success. Hey, doing today? Scott Kidd, the Yacht Captain Investor Podcast. I have my new friend, Brian Casey here. How you doing today, Brian?
Good. Thanks for having me, Scott.
You're welcome. For those that don't know you very well, tell us a little bit about yourself.
So, Brian Casey, grew up in central New York, Syracuse, and worked in the healthcare industry for 30 years, especially the medical construction side, ASC development, medical office buildings, labs, infusion centers. I've done a lot over the 30 years as an owner's representative when it comes to the medical field. And I've been working on a platform for about a year now. That is the gap that is between the owner and the architect, which is basic me and what I do in my career. I was that guy that would come in and help design the program, work with the owners, work with the architects. But there was always this gap of information that was missed between the owners and the architect, which would cause change orders, timeline issues, bank issues, because now that they went to a bank for X amount of money, and now the project is $500,000 over budget.
Yeah, cost overruns.
Overruns is huge. That one thing that I noticed, and I was always that guy for years that was sitting in the boardroom across from doctors, developers, banks, saying this is the reason why. And the reason why is that there was nobody to represent the owners, the developers, and these projects. And I felt there is a need to help the developers and the doctors in the medical field. So for the last year or so, I've been working on a platform it's under Spartan Legacy Group, and it's the Ironclad HC platform. We basically do an intake of 8 to 10 questions, and we gather that program from you, and then it puts it into different stages of feasibility studies, the size of the ORs, how much you need to invest. It gives you a hard cost, a soft cost. It breaks the whole entire project down within 10 minutes instead of going through the process, hiring multiple people to do the same thing that this platform could do. And I could get it done within 10 minutes. And it's all across the United States. And what's unique about our platform is every state has different regulatory guidelines, and this state, the platform per state breaks out the regulatory guidelines and what it would cost and what guidelines you need to follow.
That's really great, because there always has been a knowledge gap between the developer and the client, with the surgical centers, and we when we spoke the other day, we were talking about, value engineering, because, they do own a surgical business, and it does have to make money and be able to pay for the building and sustain itself and everything else and keep going. Yeah. Whereas if they don't know what the parameters are, and they don't know what the cost to build and everything else, and it's not clear where they need to be and all that, then it can get out of hand really quick. Yeah. And you sent me a feasibility study, a quick sample one, and I thought it was very great because it was very in depth. Let's unpack that a little bit and talk about, like, say for instance, I was your surgical partner building an ASC in say Texas, and how long would it take? Like, say we had a group that we'd already built some before, and we're doing an orthopedic center. How long would it take for you to do an assessment for, like, the the Dallas-Fort Worth area?
10 minutes.
10 minutes. Wow.
Because I'm going to sit down with your partners. They're going to answer the 10 questions on the intake, and then I automatically I'll hit send. It'll give you activate results, and then it pops up and formulates everything within 10 minutes.
That's very nice. So
And the next step of that is let's say, for instance, your partners in Fort Worth, Texas say, I only need 4 ORs, and I'm only going to do a certain amount of cases a day. My program will get you to the bottom of the feasibility study after the hard costs and soft costs come in, the feasibility studies, and it would let you know at the bottom if you're going to make money or not money, or how much money you will be making. I run into a couple different programs with a couple different doctors, and we were losing $1 million a year based on how many ORs they picked, based on how many surgeries they're going to do. Now, also keep in mind that also comes in play is reimbursements from the healthcare industry, Medicare, Medicaid, right? Every state is different. Every city is different. The doctors have to negotiate these reimbursements. So my feasibility study is based on the national average for that state. Now that can change, right? Once you get thicker into the project, because that's when the doctors go with their CEO and start negotiation, the reimbursements.
That's really interesting. So say, for instance, like, how would you solve that problem? Like, say that one one surgical center was losing $1 million with only having 4. What would you do to fix that? Would you find a different location, or would you add more operating rooms? Or
no. So also in the bottom there, it tells you how many more procedures you need to do a day.
Okay.
It will tell you need to do 6 more. And when I added in the 6 more, he was breaking even. And then when I said, well, how about less ORs? And then next he's making money.
Okay.
It will adjust it based on what we need to do to make the money.
Okay. So then you can really value engineer it from there, because then the outside box is going to be the cost of the box anyway. But right. for the surgeon on the inside, they're going to get a tenant allowance based on for the build out based on that.
But the key is not to overbuild based on how much patients you could put through the facility.
Yeah, and
how many partners are in the group?
Yeah, and what the demand is for the area.
And for the area, everything comes into play. But they should already know that, right? Because that's what they're doing in the hospitals. So they should already have those numbers. So when we come to the intake, they can give me the correct information or close, and then we can give them the feasibility study and what their number is going to be at the end.
Do you have access to any of these larger healthcare databases or anything like that, or are you Okay.
Yes, I do.
Excellent, because that gives you a leg up on getting these things. And if this study can be done in 10 minutes, that's fantastic, because that gives the surgeon a better view of what or investor looking at a medical office or surgical center. There are questions you need answers before signing anything. Most investors, even physicians, don't know what to ask. They miss things like on status, completion guarantee, payer mix, or how reimbursement changes hit the operator's ability to pay rent. And that's how capital gets lost. So I put together a due diligence checklist for sophisticated healthcare investors. 100 questions across 7 categories, covering the sponsor, the design, capital stack, the market, and the legal structure. It's interactive, it tracks your progress, you can even export it as a PDF. And it's totally free. The link's below. Download it before you look at your next medical office or surgical center property. View of what they need to be looking at, rather than like we're discussing before the call. Like, my buddy's doing one down the road and he's making a ton of money. I want to build one too, and that's why us as on the development side, we basically build the box, and they get a tenant allowance for that. And so there's where this is very helpful to help them figure out what size they need to build, and where they need to build, and what the demand is in the area, because then it kind of streamlines the process, because to do all that information or get all that information that you're talking about is very intensive, and it starts.
And it takes months, right?
Yeah. Yeah.
And then once that happens, once you get the program you need, and then you go to the architect's going to take at least 2 months to do the drawings, because they have to go in New York State, you have to go for a CLN approval. So they have to go to the state review board, always send something back, because the architectural drawings need X, Y, and Z. Then you have to send it back, it's 2 months.
Yeah.
It's easily 2 months, right? So in between that 2 month period of time, what I would always do is the plans are the plans. Little things change. Architects always draw to the highest level.
Yes.
I kid around, gold toilets, silver faucets. That's when my experience, when value engineer comes into play. I review all the documents. I meet with all the mechanical engineers and we break it all down. And that's when the savings comes into play. And that even goes up to the HVAC boxes that are sitting on the roof, right? Because you don't need the Cadillac.
Mm-hmm. Yeah.
When you could run on the Toyota, you're going to get the same result.
Yeah,
because what they also don't look at too is the maintenance.
Yeah, and it's going to last. The Cadillac is going to last about the same as the Toyota. Well, the Toyota may last longer, but it doesn't really equate into long-term dollars because they do have to look at the 10 or 15-year lease that they're doing. Or
and some of the things that the develop, not necessarily the developer, but the owners of the buildings, and I've been on both sides of my career, is the maintenance and managing of the surgery centers after the fact. And the maintenance that goes into these large surgery centers need to be taken into accountability, right?
Yeah.
The more expensive the unit, the more high-tech the unit is, the more it's going to cost to do PMs and maintenance and repairs.
Yeah.
Those are the things that I also can provide. Not necessarily in my platform, but me in general helping as underneath my group as an asset management, right?
Yeah.
I'm going to manage your asset. I'm going to give you the guidelines of what you need and what it's going to take besides just the platform.
Yeah, so you're looking at kind of a soup to nuts, like what it's going to cost you all the way through the project and the ongoing maintenance and stuff, because most of what we build is all triple net stuff. So generally the tenant is going to be the one
correct
doing the maintenance there, so that's we're really managing the exterior and everything else,
right?
For however, whether it's an absolute lease or not, it really depends. But there's an additional service that you can offer to the surgical group, or the medical group, because a lot of them, they might not have thought about that. It's a lot of times in real estate, people, there's that misnomer of passive income. You're just going to get money in the mailbox. But that's probably true until somebody calls you that the toilet's broken or the roof's leaking or this person moved down, they just disappeared in the middle of the night and they haven't paid, you haven't seen it. So,
Or if you live in central New York and you get 140 inches of snow.
Yeah.
So you got to clean the lots. You got to make sure everything's salted. You get slips and falls. Like there's a lot of things that come into owning a complex. Yeah,
and then the parking lot and the common areas and all that stuff, and there's all these different nuances that people don't think of just because they're just not. The knowledge gap is what we were talking about before.
Right.
Like you said, the architects always want to go to the palatial estate, build the most beautiful thing they can be proud of, which is fine, but on paper, it probably is beautiful. If you were to actually build it, they would probably never make money.
No. Yeah. No, they won't. And then once that architect gets his last pay schedule,
he's done.
He's not coming back. He's done. He's moved on to the next project. So, like I said earlier, 30 years of doing this, I take a lot of passion in this. I love working with the doctors and the developers, starting from scratch, finding the land, brokering the deal, working with the leasing, seeing the whole project through to the end until they cut that ribbon. I take pride in that, and that's always the way it's been. It's nice to have a sense of accomplishment that you actually built something. And there's a huge demand for these surgery centers and medical offices and standalone practices for procedures and stuff because as we were talking before, 20 years ago, some of these procedures, you'd have to be in the hospital for a week. And now they're done in a couple hours. You're at home, and they don't necessarily need all the hospital space. And the surgeon also would like to be in an office right there and have the operating theater right down the hall. And like we were talking, they could be going from 2 different operating rooms to, be doing a couple of different procedures, in the same day and multiple different types of things. So I think it's in some ways it's become a lot more efficient, and I think that it's going to be better for the patients for one, and better for the surgeons and everybody involved. And I would think it would bring down the cost. So hopefully that would bring down the cost of insurance. Well, yeah, The other thing too is like you and I talked about some of the centers now that I've been building over the years. You have your surgery center, your procedure centers, and then you also have your clinical space in the same building. That meant, like you said, travel. We talked about traveling back and forth.
Oh, yeah.
A lot of the doctors don't want to travel too much. They'll do surgeries in the morning. They'll go around through a door and they'll go in and do clinical in the afternoon.
Yeah.
And that works out for a lot of different reasons nowadays. The workforce is hard to find, qualified workforce. So instead of having multiple sites, multiple clinics, multiple surgery centers, we are building larger ones with clinical space inside of them. Some of them have PT. So you have physical therapy in the same site too, if we're talking about orthopedic. And then it's one-stop shopping. It's like going to a large mall. You have the restaurant.
It's like a medical mall. It's like a medical mall.
Exactly. Well said. It's a medical mall, and it's so cost efficient. And there's so many different the bundling from insurance company comes into play because now you have everything one right there on site. Pre-op, post-op, insurance, PT. Because you have to do PT in New York State 3 times before you get approved for surgery.
Oh, really?
That's the way it is, or they won't pay it.
Oh, wow.
So yep. And I found that out the hard way, which I didn't have to pay. But my first tip, I didn't go to PT. I was never instructed to go to PT. I got a bill for $48,000 after PT, after my surgery.
Wow.
And when I questioned the insurance company, Blue Cross Blue Shield, about this, they said because you didn't go to physical therapy first.
Nobody told you that?
Nobody told me.
Jeez, that's a big
So the next one I went to PT.
Yeah. Yeah, that's a no-brainer on that one.
Yeah, no, but I'm saying in the medical world, right? That's what's happening now. All different levels of private practices are different. They're building different levels than just your clinical space. Some of them, like, for instance, I did an arthritis building, right? For a large group, it was 25,000 square feet.
You want to know the one thing that separates investors who win from investors who get wiped out? It's not the deal flow. It's not connections. It's this. Due diligence. Not the skim the deck and hope for the best kind. The real due diligence. Asking the real questions like who's the sponsor and their team? What is their experience? Does the sponsor have verified exits? What is the downside of the scenario? Are there any hidden fees? If you can't answer these questions and more, you're not really investing. You're speculating or possibly gambling. I built a tool to fix that. It's called the Passive Investor Due Diligence Scorecard. It's free, it's interactive, it's 125 questions across 4 categories. Who is the sponsor's team? What is the market? What are the financials? And what are the potential red flags? You check off what you verify, score updates live. It gives you a clear assessment to help you find out if this is the right fit for your family. It takes about 20 minutes or less, and it could save you years of regret. Use it before you wire another dollar, because the questions you don't ask are the ones that cost you the most.
And then they also I put an addition on for infusion, because now infusion's a big reimbursement. It's an ancillary service for these guys, just like MRIs and DMEs. DMEs, you know what they are?
No.
DME is like if you go break your arm, the harness that goes in there, the sleeve. Okay. If you hurt your knee, it's a sleeve that goes over your knee. Those are called DMEs. Splints. So we actually have DME centers in some of the locations that we do our own fitting, because it's another ancillary service. It's another revenue of cash flow.
Okay. So having this medical mall and stuff, it would only make sense because, I think you weren't the first person that when we discussed it where, always get a surgery, schedule it early in the morning, because a friend of mine said that to me a long time ago, and I never knew why, but he was in the medical field, and I just always, he knows what he's talking about, so I'll do it. Then it just kind of dawned on me that, these guys are probably going all over, driving all over town, and you don't want the afternoon him to go through fighting rush hour traffic and stuff like that to come do surgery on you, because it's going to be very stressful for him, and then, there's more chances of making mistakes and human error or just all kinds of other complications. You don't want the doctor to have a heart attack.
Yeah, right.
Yeah,
no.
And
it's stressful for the patient, right? Let's start with that.
Yeah.
The patient's nervous because he's been sitting all day waiting for surgery. He can't eat, so he's hungry. He's irritable because he's hungry, and he's nervous. it is nerve-wracking to get surgeries. And so if you're sitting around all day or you're waiting or they're an hour and a half behind, it's a problem.
Yeah, it really is. And I would think, this makes it more efficient if they're all in one place. That's why they can be so more efficient. And, you were talking about these 23-hour facilities as well. I think that's a really, like you were saying, that's the way everything's moving. And I see that too. And I see that, because we're building these, not because I see a lot of opportunity there, but I think it's going to overall make it better for the patient where they can do outpatient services and, they don't have to have a doctor that's stressed out, or they don't have to sit around all day and wait for surgery. They can schedule it at a time that's more appropriate for them. They're not beholden to the scheduler in the big hospital where a lot of times it's, they're shuffling stuff around because they're very busy.
Yeah. And it's hard nowadays.
Yeah.
To own a business, a large orthopedic or arthritis group or heart cardiology group, the reimbursements have gone down, but the full-time employee and the overheads have gone up. Mm-hmm. So there's stress there, right? Because every month they got to pay their bills. They got to make payroll every 2 weeks, and sometimes patient care suffers with that.
I would think so.
Yeah, it does. I'm lucky. We got, it's really good, but I've seen it in other groups. It does suffer.
Well, I would think so. That's a lot of different businesses where the reimbursements have gone down, or the just the overall pricing of certain things have gone down, but yet all the costs still keep coming. I mean, I guess you could say that for a lot of households as well. Of households that our income becomes less or is coming less, and the costs keep going up and up and up, and that's applicable to this. And I know this as far as real estate, that these centers and stuff are a lot more stable than a lot of other asset classes, just because healthcare facilities and healthcare in general is just something that we all have to do. There's no way around it as we get older. Like anything else, as we get older, we cost more.
Correct. And medical feels not as much as office. Medical will sign 10 to 12 year leases. Mm-hmm. They'll sign longer term leases because they don't want to go through the whole process of building, moving. Patients don't want to travel now to a new facility. They will sign longer term leases.
Yeah, and that's
so where multiple tenants. Yeah, the value of that building's gone up because of the rent roll.
Yeah,
there's more value to the building. And medical, they don't go anywhere once they're in.
Sticky. They're very sticky.
Very sticky. Correct.
Yeah, and really, like with any real estate, you're really buying the leases. That's what you are doing. But and they're there because it's like in a lot of other businesses where they want a good, stable location.
Yeah.
Know that they're going to be there, and so that their patients, they want to know that they're going to be there for the long haul. And chances are they're going to re-up the lease after that anyway. It's not like they're going to move out because it's a tough business to move.
Right.
And that's why they're so stable.
Yeah. So part of my platform too, that I can do is put in the information of the leases.
Yeah.
Square footage, how many years, and it will come up with a study based on what the turnaround is going to be and the outcome of what you put into the building based on what your rent rolls are and what your money turnaround is going to be.
Does it take into account what the average lease term is in that area, or is
you broke up? I lost you.
Sorry. Does it take into account what the average lease terms are in the area, or do you have to input that as a?
I would have to put that. You could do comps in the area.
Okay.
I'm working with a developer, and they know that they have leases that can get $26 a square foot, triple net, or $30 a square foot, triple net. You put that formula into the system, and that will tell you based on what information you give me, kind of like the medical side of things. It will give you what your turnaround's going to be.
Okay.
Based on what you built the building for and all your soft costs, everything that comes with it.
So you kind of meld those together and kind of come up with the finished product as to what's going to be best. Well, that's fantastic. And I think what we probably should do as well is one of these times is do at some point do a live demo of the software. Like we pick someplace like Dallas or something like that, which everybody knows, center of the country, and
Yeah.
and talk a little bit more about this, because I think this is a great tool, because this will optimize, one, for the developers and also for the surgical partners.
Yeah.
And you can really get down to some really nice value engineered product that is good for everybody. Because if you come in under cost, it's good for the surgical group. Granted, you're not going to build, the thing that you get the cheapest possible product, but you're going to build the biggest quality you can for the area, and it's going to be win-win for everyone.
In over the 30 years of doing it, at surgery centers, I've never come under budget, because if there is change orders that do happen, we have like a retention. There's a little bit of money left in the fluff of the numbers, like that. What my platform does is it kind of protects that change orders. It protects all that money, extra money being spent. You know what I'm saying? Before you get into the weeds, you're going to meet with me as a developer, and you're going to say, hey, Brian, I want to build this building. I want this much square feet. The gentleman I'm speaking with says that he needs, 10 exam rooms, an x-ray room. We need a break room. We need a janitor's closet. We need a waiting room that's going to sit all these different people. And I could put that in my program, and I'm going to tell you exactly how much it's going to cost, right?
Yeah.
And I'm going to give you a hard cost and a soft cost. We're going to go into an
Still guessing your next move. As an investor, most people have no idea where they actually stand. The Investor Readiness Scorecard changes that. In 5 South, just 10 minutes, score yourself across 5 critical categories: financial foundation, education, strategy, network, and action readiness. Instantly discover your investor phase and get your exact next move. No more guessing. No more spinning your wheels. Take the free assessment now at investwithscottkid.com.
Go into an architect, you go to the architect, and the architect's going to draw it up based on the information you gave him, right? At that point is when you sit down with me or somebody else and you value engineer, and that's where the cost comes back to you, right? But at the end of the day, that cost could be used for some of your soft cost items. So there's never really a savings, because if you go to the bank for $10 million and it costs you $9,500,000 and you got to buy $500 in signage and stuff like that, it's never really a savings in my mind per se, because you're spending that money that you're getting allowance from the bank on the project. You see?
I think you just reallocate it towards.
You just reallocate it to somewhere else, correct?
So you're going to figure out what's the best case use for those that funding, or you might even keep it in reserves or what have you for something that you have to spend for later.
Correct.
That's great. Well, I mean, this has truly been really great and eye-opening, and I know been very beneficial for our audience. What's the best way for people to find you and find out more about your software tool and about Brian Casey?
So SpartanLegacyGroup.net is my platform. You can go to my platform, again, SpartanLegacyGroup.net, and it's going to take you into the platform, and you can kind of do your own little demo of what it's going to look like. Reach out to me through there. There's a link that you can put in your information. You can email me directly, and I will respond, and then I could do a demo for you.
That'd be great.
Yeah,
great.
I just don't want to give all my sauce away, because there's a lot of people out there that's that's secret sauce. So what I do is I'll do the demo, because how it works is, Scott, you would go to my platform, and then when you would put in your intake, and it goes access code. You would need me to give you a special code for Scott Kidd, and then you would be able to go in there and get all the information you needed on this platform. So nobody else can steal it. It's all yours. You can print it. You can put it to a PDF. It's yours.
Perfect. No, that's great. Like I said, we're definitely going to be talking tomorrow, actually, with our guy.
Yeah, we are talking tomorrow.
Because I know there's a lot of benefits and a lot of synergies here, because this is a pretty valuable tool, and I really appreciate you coming on.
I really appreciate you speaking to me and letting me into your world, to be honest with you. I'm just a guy sitting in Syracuse, New York, that for the last year at night, and we built something, and I love my wife and my kids, and a lot of time away from them, sitting around doing things. And if it wasn't for family support, I wouldn't be where I'm at. So I do appreciate all that, and that's for sure. And I appreciate you. And I think this truly, from the bottom of my heart, could be something special for developers and clients, because like I said, over the last 30 years, I've seen so many people taken advantage of, and it bothers me. It's almost being bullied.
Yeah.
And I'm not a fan of it.
No. And, and it's because, a lot of people don't know what they don't know, and it's harder. It's harder to fill that gap if someone really doesn't know what, or who to talk to and stuff. So I think this is going to help immensely, and I really appreciate it. And I see that there's definitely going to be some great synergies here where we're going to be doing a lot of different things.
There's a big gap in what we're talking about.
Yeah. I mean, we're definitely going to be following up, have you back on in a few months and talk more about, all the great applications that this is going. So I really appreciate again you being here.
I appreciate you having me.
And I'm Scott Kidd, the Yacht Captain Investor Podcast. It's just a quick reminder that the best investment you can make is the one you make in yourself. So invest heavily in you. See you next time. Thank you.
Thank you.